I am talking today about learning from stories. And in the spirit of learning from stories, I'm going to start by reading one for you. So, the sparkling trout stream seemed peaceful and serene. As I stood next to Grandfather, both of us in waders, silently casting flies we had tied the day before. No one said a word. That was the rule. The whole activity was to just be, to not use your brain. I was terrible with this and started to imagine the trout that I would soon catch. My trout had teeth, big and razor sharp. He would snap at my fly and sever it from the line and spit it out. Then my trout would start to chew my remaining line, chewing it up and chewing it up. Eventually he would reach my pole and chew that too. My trout consumed my line and my pole. He would grow and grow. By the time he reached me, I was sure he was going to be the size of a grizzly. He would laugh at me, a throaty, gurgling sort of laugh. My heart started to race, but I didn't say a word. Grandfather stood and cast with the perfect rhythm. His fly danced above the stream. My trout hadn't bothered him in the least. Looking at Grandfather, my heart slowed. My trout stopped his laugh and started to shrink. I looked at my pole and my line and snapped the line just as Grandfather taught. I watched my fly dance above the water of the sparkling stream, peaceful and serene. So, why did I tell you that story? Because stories actually stick, and our brains work so that we remember those kinds of things. So this story about a girl, her grandfather, and some pretty scary teeth. So perhaps she'll grow up to be a dentist one day. So now to the meat of the presentation. I have that divided up into 3 sections. We're going to start talking about workshop. The second is practice, and the third part is engage and reflect. And all of the examples and the things I'm going to talk about come from out of the context of clinical dental ethics and professional practice. So this starts, and what I teach is I teach at with the third-year dental students and the fourth-year dental students. So the workshop part is our third-year course. And its structure is based basically on the 5 principles from the ADA Code of Ethics that we all should be familiar with intimately. And remember these every day when we're in the practice and we're on the clinic floor working with students. So the format for this is a basic workshop format. And so like a workshop would do, you start out with what I like to call a sort of a teaser case and warm up the students. Students come from a clinic setting or somewhere else, and it's nice to kind of get them out of there. Obviously, the things that I teach are a little bit different than your normal biochemistry or operative and that sort of thing. So here's the case of dating Dr. Green. So this is the part where you all get to interact with each other. So we're just going to warm you up a little bit. So if you look into your packet, you will find 2 versions of dating Dr. Green. The first one is the student version. The second one is a faculty guide that has sort of questions and things that are going to come out of this. So what I'd like you to do is take a few minutes and talk to your neighbors. So I would say maybe groups of 2 or 3. Remember, there are people kind of behind you or in front of you that you might want to do. Read the case. This is a case of mutual attraction in a small town. So we're going to see how this works. And I have a nice cartoon from my colleague at the University of Minnesota, Dr. Eric Mills. So you'll see a bit more of his work as we go forward. So this is where you get to make some noise and move around if you want to. So. Oh, here. Yeah, start with the student version. You know, and then as you kind of go through, I mean, that's what the students start with. Yeah, let's see if there's more over here. Hold a second. Let's see. Where's the pile? Can you share with a neighbor? Do we have more handouts? So, would never happen in New York, this sort of thing.
his patients are outside. Yeah. That's it, baby.
Yeah, everybody in Iowa knows each other. That's good. So that's good.
The husband got to inspect the woman, preferably she should be denture, so no further expense to the husband. How do you like that?
That is very impressive. I don't think they did that in Germany.
I hope not.
Okay, so what do you guys think about our poor Dr. Green, who's looking for true love in here? So did you guys come up with some good stuff? Never happens. Look elsewhere. Okay, so where would he go? I mean, you know, it's a small town in Iowa. Online, okay. Oh, there you go. So Match.com, that's how I met my husband. So worked well, and I was in a city, so I don't know. Maybe it would work in Iowa too.
If she switches dentists, that would be a different story.
Yeah. Well, so what do you think that Dr. Green should, you know, say in this case? I mean, he has the card.
Very flattered, but I don't date my patients.
But he really likes her.
And transfer to another dentist.
Find another thing. Okay. So what I like about doing cases like this, and you'll notice that I start out and they're basically are, you know, kind of unfinished stories. So and it starts everything off, you know, fairly quickly, because when these kind of things come up and it's sort of like, poof, there you are, and you're in the middle of a clinic or something like that. You might, you know, Dr. Green might get a little time to think about it because he has a card and he maybe can go home and decide what to do. But you can do those sorts of things. And what I like to do with these is like kind of play what if. This is an awesome thing to do. You can make this story into millions and millions and millions of different stories by just changing things up. So you have, what if Dr. Green decides to date Rebecca? How does he do it? You know, what does that do? And what if it goes bad? How do you handle that? You know, of course, if you don't date her, you don't go to the next thing. What if Rebecca's a man and not a woman? You know, you can change everything up. You can make Rebecca old and young and all kinds of different things. Or yeah, it could be married. Right, there could be, that's right, they could be married. So you can actually make this as absurd as you really want to, which is great because sometimes you exaggerate things to a point where it almost becomes absurd, although truth sometimes is stranger than fiction. You can actually sort of see what you might do, you know, in maybe a less, you know, dramatic situation. So you can find kind of that tipping point to be able to make a decision. So we can get back to things, and then you guys can take these home and look at the sheet for the faculty, because a lot of conversations can come out of this, what seems like a relatively simple story. Does the size of the treatment plan matter? What if Rebecca's just coming and, you know, getting her teeth cleaned every 6 months and doing a prophy? But, you know, is true love, do you want to stand in the way of that? What are the risks? What do you do? How do you say, okay, you know, I want to date you. I want you to go see another dentist? Or what if you want to date Rebecca and you're the one who's initiating that? So you have an opportunity to change this to employees and talk about, you know, the vulnerability of the patient, hierarchies in the office, and all kinds of different things. So we end up having lots of interesting discussions around this one. So that's kind of the warm-up for this particular workshop. And the students actually do some take-home assignments. And at this one, they reason through a problem, so they get a case. And then they kind of think about it, and they get to create an animated video of the conversation that they actually have with the patient when they get down with that too. So I found it's really interesting for students to be able to actually hear. So it's not so much about watching the video as it is about hearing what the dialogue sounds like in the conversations with their patients. This is a story which actually is a part of a case that's from a textbook, and it's used as the case prompt for this assignment. And this is a case of suspected substandard care. So the dentist sees some care that looks like, oh, maybe it's not really up to par, I don't know all this stuff. So, and Janie Friends here has gracefully decided that she would let us show her video of what she created, and this is her conversation then with the patient around this topic. And I'm going to have to go over here to get it to go, I think. Hold on a second.
Howdy, partner. What can I see about fixing up for y'all today?
My new bridge is loose and it's very uncomfortable.
Well, let's pony up and have a look-see. I took off the bridge and see that the bridge does not fit very well with the prepared teeth, which is why all gums are inflamed.
Is it because of something I did or the other doctor?
You know what they say, always drink upstream from the herd. There could be many reasons for the bridge not to fit, so I cannot pinpoint the answer. But now that we know what the problem is, hopefully this will make y'all feel better.
I just got this bridge this year. I cannot afford another one.
I reckon I will call Dr. Singer when she returns and explain the situation. Hopefully she can help you all out with the cost. When in doubt, let your horse do the thinking. And bring her the bridge so she can take a look at the fit as well. For now, I will make you a temporary bridge so your tissues can begin to heal.
I just do not understand what went wrong.
Well, I took to the life of a cowboy like a horse takes to oats. It's a delicate balance between keeping the bridge cemented in place for solid function and working with what remaining tooth structure is available, which is part of the reason it became loose. I cannot say for sure because I wasn't there during the preparation though.
I guess that makes some sense. I was the one that let the teeth get bad in the first place.
It's a good thing you care enough now to keep your remaining teeth strong and healthy like a horse. I had a hog-killing good time with you today. Now head 'em up, move 'em out.
So, yes, you can see that Janie got the idea. She communicated really clearly with the patient, didn't really throw the other provider under the bus without knowing exactly what was going on. And so it was good. And prior to this, like I said, she's gone through, what are the options? How would you handle this? And so it could have been handled in any number of ways. So this was done with extranormal.com, and so I have an interesting story about this. So anybody who ever wants to use this kind of thing in a classroom, be sure you have multiple options. So I'd signed up for an educational version of this, and it explored a lot of different things. So, well, that's great, so I paid. It wasn't very expensive to do all of these things, and got all kinds of videos and stuff. Well, then, as online things sometimes go, Extra Normal basically tanked in July of this year. So I'm left going, okay, what am I going to do? I have to find something new, and I was already trying to look for other options so students could do that. So I'm kind of letting them do whatever they want. But Go Animate, who decided to market itself to previous Extra Normal users, so evidently it worked a little bit because I'm like, okay, I'll go there and check it out. And there are more options down here on this link too if you want to go for different things. So I said, well, okay, how hard is that? Because you don't want, when you're trying to teach these kinds of classes, the technology to overwhelm what you want the students to get out of the assignment. So it needs to be easy, can't take a lot of time. And so I basically went online, signed up, and created a video and uploaded it in 30 minutes. So, which is pretty good. Students have 30 minutes to do a video. And here's what I came up with. And so I guess I should have just stayed over here. Okay, and
Hello, Dr. Zebrason. I am having a terrible toothache in my right tooth here. Can you help me?
Mr. O'Hippo, let me take a look. We must take a radiograph of that area.
A radio what? I don't really care for music.
Oh dear. Mr. O'Hippo. A radiograph is a special picture of your tooth. In the old days we called them X-rays. We can take pictures digitally now.
Does that mean you use your fingers? You do not have any digits. only hooves. I cannot see how that will work.
That is a different kind of digital. We use a computer with digital technology to get the picture we need.
Dr. Epperson, you have taught me a lot already. You are a knowledgeable dentist and very good at explaining things to me in a way I can understand. I feel comfortable with you. And I trust that you will advise me of all my options, the risks, the benefits, and the outcomes I can expect. That would be the prognosis, right?
You are correct. Now let's take that radiograph and get to the bottom of your right tooth's problem.
So Mr. O'Hippo actually had a pretty good dental experience, which is great, and in less than a minute and a half, kind of laid out all the things that you need to do for informed consent, and communicates with the patient in a respectful manner in the way that they should. So actually, this video, which really wasn't intended for anything except for to see how long it took to make it, may actually make it into one of my colleagues' treatment planning courses for some second-year students this spring. So we'll see what happens. So now, now we're moving on to practice, and evidently I need to practice a little bit more with the technology or something, to the ghost in the machine there. The students, do their series of workshops in the third year, and so in the fourth year we start in the summer, and they get an opportunity to practice their communication skills and decision-making skills in complex contexts, which you would run into, ethical dilemmas. And so what is an OSCE? You guys are all educators, probably know what this is. It's an objective structured clinical exam. For our purposes, really, I like to change the exam to experience. This is a formative experience and not a summative evaluation. So it's pretty safe for the students. They just can learn by having the experience there. So, and we've done this for 4 years, and every year we do 2 cases, and in the room we have a student who acts as a clinician and an observer. So the observer student, in a little bit, I'll tell you why that is important. And we've done a case of domestic violence, a case of unrealistic expectation and boundary issues, a case of probable oral cancer diagnosis, and this year we piloted informed consent with a patient with sort of questionable competency to make decisions. So domestic violence always gets in there. That's probably one of the most difficult situations that the students can face. So I've selected a couple of examples, little clips from this, of what that looks like for a student. And this is Maria, and she is ensuring confidentiality for her patient. It's also short, so.
Like if there's any issues you would like to share about the family or your husband, maybe there's always help that we can offer. So if you ever feel comfortable, you can definitely ask me. And it's all incognito, so no one will know about that, not even your husband or your family. It's just between you and me, and the person who can maybe help you out a little more. And I would love to address the teeth issues you have, but I would also want to make sure you're safe and just healthy overall as your whole body. Okay, so we will probably go ahead and get started on the exam if you don't mind. Then, do you have any questions otherwise, or you want to tell me anything, or?
I don't think so. No.
Okay. So I guess that would be. We'll go into the exam.
Okay.
All right. Okay. Sounds good.
Okay, so she does a nice job of that too, and it's kind of uncomfortable. I mean, you're used to talking to patients, and the patients don't actually, want to open up to you, and you try to do that. So that's part of what makes this scenario challenging. What happens after that? The standardized patient actually gives feedback to the student. So, and this is a clip from the feedback that Maria got, and Maria's comments about the experience.
Emily, nice to meet you.
Maria.
Brady.
Nice to meet you. Very quick. Yeah. So, we have plenty of time for feedback, so we'll just start with it and we can have a whole conversation if you guys want to. How did that go for you?
Well, I kind of didn't expect the, the scenario would be kind of one of those ethical issues. I just thought it was just more medical issue, and I guess they prepare us for that, and they kind of tell us, like, you have to know there's resources, but it's always a little difficult to approach a patient like that, and get close to them or like get that comfort level so that they can open up to you.
Yeah.
So I don't know, maybe I should have just explored a little more on the family or just how exactly that happened.
I thought you did a really excellent job of, building that rapport and really slowly, just asking different questions about family and other things and about my medical history and like letting me get comfortable with you. I thought you did that really well. And actually, I was supposed to not really have eye contact, but I felt really comfortable with you and with your eye contact, and it was really hard for me to continue not making eye contact with you. So you did that really well. I think that I was really ready to talk to you, like if you had asked one more question.
So, so this is a very valuable part, and the students really like the feedback from the patient. It's not very often when we're practicing dentistry that our patients are going to sit down and talk to us and say, hey, this is what I thought you did well, or you really kind of communicated in a bad way here, or whatever, and they do it very constructively. Oh, you're from New York? They just say that outright here? Yeah. Well, I'm from Minnesota Nice, and so nobody says anything there. So that's kind of how it is. But it is good. So usually, if we have patients that are upset, they just sort of stomp out and leave or something, or ignore you. And if you've listened to anybody else talking about standardized patient OSCEs, really the big part about this is we really have, and they'll say this all the time, we have the encounter to get to the debriefing. So after the students go through their experience, and it's important when you have kind of intense situations like this to actually talk things out, because the students bring all kinds of experiences to the table, and you want to make sure that if there's some things going on, you can identify those. So we do, a loosely structured debriefing with the entire group of students, which is about 12 that go through this. And we start with adjectives. We just ask them, in one word, tell us about what your experience was today. And so I made a word cloud. I mean, we hear a lot of the same things. So every time we have a group go through, we get these. And you can see awkward is the big winner here. So, which if you put yourself in the shoes of those contexts, it's going to feel awkward and uncomfortable. I like that realistic was up there. You're shooting for realistic. You can't guarantee that every student that comes into your clinics is going to have an experience with a patient and have to communicate about domestic violence. So this is one way of allowing them to practice some of those skills in a place that's safe. And if they make mistakes, you learn from those. And so I think that's a very valuable thing. We also ask them if there's anything they would like to change. And as dental students, you might imagine, they miss their instruments. They want their instruments when they're in there so they can feel like that's real. We do not have, our simulation center doesn't have like a dental clinic thing in there. We don't follow OSHA, so we have to explain that every year about why we don't have instruments, and that it's really about sitting down and having a conversation with the patient beforehand. And again, they really like the feedback with the patients. We also ask what things they thought they did well, or they thought that the person that they were observing did well. A lot of these responses you actually get from the observer. Students are, at least in Minnesota, I don't know, maybe New York, they like to talk about themselves more, but don't always see the same thing that the person who's observing them does. And they have a sheet, and they're looking for nonverbal cues. They're separated from it a little bit, and so it's very helpful to have the observer there to help bring some of these things out. And then the last thing, we ask is kind of takeaways, and what did you learn, and what did you do? Students actually found out they felt more confident when they were done, like they did pretty well. And and I think I might have some new strategies to deal with situations that are uncomfortable and awkward. So that was good. We do debrief the actual context of the case a little bit too. So with domestic violence, we'll talk about mandatory reporting and all kinds of different sort of what ifs, this were a different scenario, because that's going to present itself in a totally different way for almost every person that is experiencing some of those things. So it's not quite done yet. They're actually done with their OSCE, and it's the end of the summer. As you can see, it's all videotaped, and it's saved on a secure website, and the students actually can go back and watch their videos. And we like to have them do that. So, but I encourage them to take a little time and get that distance, so you can get a little bit of that hindsight and watch yourself and see, you know, what you look like. So it'll be interesting to see what I look like on video. And I pair the students. I try to pair them as best as I can. It's not 100% because just of the numbers, and by case and by actor, so that they actually are paired with the student and they can watch the same scenario with the same actor in that, and they do an assessment of their own video and an assessment of the peers' video. They do that separately, get together, talk about what they saw, see if they saw the same things or assessed it in a similar way, and then they each write a reflective essay at the end. So this is one of the things. Here's like, if we have some time, let me see. Oh yeah, probably a little bit. And I think, you know, it's good to stop and think a little bit about the stories that you have from your practice or interacting with patients or students or colleagues. And so think about some of those things. Talk to your neighbors a little bit about what those things are. Chances are, if you had an experience that you learned something about, you're going to be able to share that with someone else, and they'll be able to learn from that as well, because everybody's different. That's a wonderful thing. Matter of fact, your whole life is full of stories. So cases are stories, you know, patients come with stories, and that sort of thing. So I'll give you a few minutes for that, and then we'll see what you have. And you might think about, okay, well, this is good with ethics. How might this work in whatever it is that I'm teaching, if I'm on the clinic floor, if I have a class? So I'll let you guys take a tiny little break, and then we'll move on to the next section. So talk amongst yourselves. Yes?
Are the students briefed at all, like you did domestic violence? So that's a D3. So in there, when they come to the school, does the school let them know what the policies of domestic violence are in the state of Minnesota, and what a professional's responsibilities are in that?
Yeah. So keep that. When we get all done, ask it again, because they aren't blind. So yeah. Okay, are you guys coming up with all kinds of brilliant ideas now? To figure this, is anybody brave enough to talk about what their stories are, or how they might use stories in what they're doing? in this group? This is the part where I have to try not to say anything because I like to fill that empty space. So don't worry, you're not any different than students. So he's pointing, does he have a good idea? All right, let's hear it. Oh, that's a problem then. Okay, so I think I have some students who think that too, and maybe they think that about me, I'm not sure. But anyway, so keep those kind of going around and talk to each other, and you might figure out a way to do this. I wanted to answer a question because, I'm sorry, what was your name?
Peter.
Yeah.
My question was that, like for the domestic violence that you showed, and that's a D3. I was wondering if the school somewhere in the curriculum where something talks about domestic violence and what the laws are in the state of Minnesota, so that they are somewhat prepared. I guess you're looking for some of that in what they're going to be talking about.
Right, and the students don't necessarily know they're going to get a domestic violence case when they do the OSCE, but they have talked about it. We've discussed it actually in one of the workshops under beneficence. So we have an opportunity to talk about mandatory reporting for children and vulnerable adults, where you go, CPS, APS, some of those things, and that you need to know your state laws, so they have it there. They also have it in a first-year course that's part of dental public health and some of those things, dealing with just abuse and all kinds of abuse, not just domestic violence, but substance abuse and some of those things. And then they also get it kind of after that in the legal class, so they get, kind of that reinforcement of the legal stuff. So they get it at multiple points in time. So they know that. And it's one thing to know the stuff, it's another thing to have the conversation. And that's why, this is a valuable, way to see, okay, what am I going to say, and I think something's going on. It might be sometimes just easier to just pretend you're not seeing what you're seeing. And so that's part of why that's difficult and in that situation. So, okay, so now we're going to part 3. And this is the engage and reflect part. This happens after the OSCE. So these are ethics and professional practice salons. And this is a new thing that I'm trying this year. So we're running the salons from October through March through spring break. Our 4th year students, by the end of 4th year, pretty much, whatever. I don't know if that happens in New York or not, but in Minnesota, it's been a challenge with 4th year students. So we actually are doing this. And part of the reason is our students spend a lot of time on outreach in the 4th year, and they really value the time then when they're back on campus to see the patients they have, because they're assigned patients that are there. They're trying to get treatment plans done. They're trying to get competencies sort of assessed and everything else. And even though that in the past I hadn't taken them out of clinic that much, it's just, this way they do these before they come to clinic in the morning. I'm not pulling them out of clinic. It's also an opportunity for them to self-direct their learning, which is what they're going to have to do when they graduate and get out. And they're going to have to keep their license up and do those things. They're going to have to identify where their weaknesses maybe are and where they need to go, what kind of continuing ed to take, and some of those things. And it also gives them an opportunity to be responsible and accountable. So I particularly like that part. And I also looked at this as a bit of a faculty development opportunity, because I kept hearing all these great stories from my students. Well, some of them weren't so great in terms of there were kind of some unsettling things that I heard, but stories nonetheless about things that would happen with them, with their patients, with colleagues, with other students. And it's like, and then, I would hear of incidents, and other faculty would say, oh, go talk to Dr. Quick, she can help you with that. So I'd hear all kinds of things. Like, well, somebody else needs to be able to hear these, because I'm learning a lot and doing these things. And we really need to have more faculty on the clinic floor that actually can deal with some of those issues, and to have conversations in the time that they're having them, so that the students are comfortable talking to anyone about some of those things. So I enlisted several faculty, clinical faculty, staff, administrators, and then invited practitioners from the community to come too. So anyway, so a salon. So instead of going to the OED, I just decided I'll just go to Wikipedia. It weighs less and it has the thing. I particularly like this definition because it talks about the inspiring host, and that would be me. And I don't know how amusing they are because we have some pretty heavy issues there, but that was what was sort of preceded the idea of calling them salons. And so really the learning goal overall is really to help not just the students but faculty and everyone else to be able to have really smart decisions or discussions around decision making in challenging contexts with their peers, with colleagues, and that sort of thing. So I've set this up so really everybody is a colleague. So we've got everybody from staff and administration. You can see the back of the dean's head. He came to, this was the very first salon we had on Professional Relationships 1, which is relationships with patients, staff, and colleagues. And dating Dr. Green was part of the cases that were used here, along with one about what do you do when your patient behaves inappropriately or badly, and that brings up all kinds of interesting conversations too. So they had a very good dynamic conversation around that. And the facilitator role is really there not to teach but to guide and to help facilitate that. So the facilitators, whether they're an assistant, somebody from the community or faculty, they bring a large amount of experience to the table, but so do the students. So I like to consider everybody who's there a learner, as well as the facilitators are facilitators too. So, and at the end of the salon, 5 minutes are left so that they can kind of do a in-time assessment of what they experienced in their conversation, and then this gets summarized for each table that's there, and then the students do a reflective essay. The students are required to, for the course, are required to attend 2, and I've got 5 more topics that are going through the mix, and some might get repeated depending on how it goes. So the schedule is based on the facilitator availability, and they have to do, for each one they come to, they do that assessment of the discussion, and then they do 2 reflective essays. They're invited to come to as many of the salons as they want to. Since I've only had 1, I don't know how many students are actually going to come to more than 2, but we'll see. So jury is out on that one. And their reflective essay, really what I want them to be able to do is to sit back, think about the experiences that they've had in the clinic and elsewhere, and bring those to the discussion that they had with their colleagues and peers at the table. So here's some things from the first batch of reflective essays. So I was excited. People were kind of charged up about this. Maybe not 100%, but faculty liked it. The people who came in from outside thought it was amazing. Everybody seemed to get something out of it. And so we'll see. The salons have various formats. Some of them are case-based. Some of them have readings and online components. So, but we'll see how that goes. And next week we're doing one on dental tourism and culture. So that, I think, should be an interesting group of discussions and reflection papers when that's done. So we have reached the end of the formal part of this. Here, I'll just do a very quick summary. This is how I kind of see the way this goes. It starts out structured with the workshops, a little bit more structured, with a little more guidance. Gets into the practicing part with OSCE. The salons are self-directed and reflective, and the ultimate goal really is you hope that the students take what those skills that they have to have open conversations with colleagues where they don't feel like they're being judged and that sort of thing, and have differing points of view, take that out into their practice so that when they have issues that they run into, that they're comfortable talking to each other. So thank you, and anybody has any questions? Ask away.
Karen,
Yes.
the salons to get faculty and staff participation, are there incentives or is this totally voluntary?
It's the inspiring host who goes around and asks people. But what we did was I did an in-service training for 2 hours and went through all 6 of the topics. and gave continuing ed to anybody who was there. So the outside practitioners, the staff, and the faculty were there. And so we have a hygiene program, so we have hygiene faculty, we have a DT program, so we have faculty from dental therapy, which is small, but we had that, and then we have the DDS program there as well. So we do that. I have an online kind of training module. At some point, it'd be nice to figure out how to give them continuing ed for some of those things. So it worked to have it, I mean, for us, early in the morning before clinics start, because you'll be able to get some of the clinical faculty who can actually take the time to do this. And they do provide, they read the essays, and they've actually enjoyed that. So the salons are an hour long, just in general, and then everybody goes to the clinic after that. So it's not a huge time commitment, and not everybody facilitates each topic, and it kind of gets mixed around that way. So it's kind of like sharing the wealth. So, yeah.
Out of curiosity, what time does clinic start?
Clinic starts at 9. So the students love this part, you know. So I tell, and they have to RSVP. What time do they start here? Like 7 or something?
The day before.
The day, yeah, right, the day before. So we have had, you know, students are like, could we do it after clinic instead of before? And then you're like, well, who, you know, so I mean, there's always, we learn from doing this, so we're working on trying to figure out what the best practices are to get the most people kind of there and involved in the salons, because the more people who participate, yes, the more lively the discussions are when you're doing that. And I always love a good debate and all of those things. And so even with topics and some of the stuff, the faculty have been really good about saying, hey, this would fit into this topic area. And so they then help to kind of create what the pre-salon activity is and some of those different things. And so my guess is that with the topics we have, that will kind of morph as we learn from the discussions we have. So, and with some of the reflective essays, when people are talking about what did you learn, what was going on here. And so I tried to pair, there are 2 facilitators at each table, and so I tried to pair them up, having an inside the school person and outside the school person, and then or a dentist and then a non dentist, so either a hygienist or an administrator or something like that. So so the format seems to be working fairly well right now, and so there's probably opportunities to do that. But yeah, it's early in the morning for the students to get up and do that. And so but they're dental practice, and they actually are open for people, executives who go to work or whatever early in the morning and things like that too. So eventually they're going to have to not sleep till 10.